welcome to FII, For Your Innovation, a series on innovation that we launched recently. In the earlier episodes, we looked at the realities of healthcare and the drivers behind innovation. Today, we'll talk about something that matters most, the outcomes, from better data, better technology, and a better operating model, and how that is driving a much better experience for our patients, for our providers, and the consumers that we serve. I am pleased to have with us Sue Arthur, Chief Operating Officer of Optum, for the third episode. Sue, really happy to have you here.
Thank you, Rohit. I'm delighted to be here and to spend this time with you talking about this important topic.
Great. So as we talk about healthcare innovation, we talk a lot about technology, smarter tools, but I believe that the key measure of success is how these tools are actually driving a much better experience to our members and our patients and our providers. Whether it's better connected applications, whether it is setting up appointments, whether it's just the entire navigation through their entire care journey. I think a better patient experience in every touch point really makes a lot of difference. So let's start this conversation with talking about the patient, the consumer at the center. As you think about innovation, what are some of the things that you are seeing which are really helping us drive a much better healthcare experience?
Yeah, thanks for that question. As we think about the patient and the journey the patient takes in engaging in their health, but also in the healthcare system and every element of that journey, we're seeing incredible progress in terms of how patients access care, how they think about their care journey, and how they understand their cost of care, how they think about proactively engaging in the health system. So the technology and innovation happening both from device to the administrative process to implications of value-based care and how the clinicians and the clinical system engages the patient through their journey, we continue to see advances at paces we haven't seen before.
Now, those are real changes that are creating a much better experience for our members. Whether it is connected care, whether it is focus on making sure that patients get better clarity on their finances. I think these are changes that can really help us drive a much better experience for our members and our providers. But let's move to the future and talk about what are some of the trends that you are seeing that you are most hopeful about that can really transform the way healthcare is driven right now.
Yeah, thanks for that question. Trends we are seeing that make us optimistic about the impact of generative AI and modern technology on the healthcare system start one in the clinical setting. While we don't expect these technologies to replace clinicians, we do expect these technologies to continue to make work for clinicians easier and more effective to the extent we can continue to inject technology in the administrative workflow that allows clinicians to work at the top of their license, to have access to data, to understand the integrated view of the patient. That is a super exciting space, from autonomous or ambient listening all the way to understanding all the clinical elements of the patient's care. Secondly, for the patient, data around the patient getting more and more connected, from wearables to medical devices to understanding their entire journey inside a complex system. That is another place we expect AI and data to come together to have an enormous element. And then if we think about other parts of the system, behavioral health, mental health, care settings that are quite disaggregated right now, and how all of that comes together, and where does AI help with things like what's the next best action for this patient, no matter where they are on their journey. So I think there's a lot of ways you can think about injecting unique and individual solutions, but then when you pull it up and you think about what is the macro implication of the continued injection of these technologies, we'll operate a very different system as we go. And that is exciting to imagine for the patient, but also for the clinical worker who is managing a very complicated system and understanding of the patient.
Yeah, and I think AI will be the real change. AI as a great enabler across all settings like you described, whether it is in the administrative area or in the clinical setting. AI, I think, will be a real change maker for the way we do healthcare. Also things like you mentioned, mental health well-being. I think bringing technology, data, process, all of them together and harnessing the power of these three elements coming together will drive real transformative change. So thanks a lot for that vision, Sue. Just bringing it back to Optum Global and thinking about what are some of the ways in which Optum Global can really support and drive these innovations for the enterprise?
Yeah, in that we see these business processes and really everything we just talked about, the clinical setting, the admin part of it, the patient at the center, where's our company going with value-based care? We have an opportunity to think about that integrated workflow, the integrated experience, the payer, the provider, the patient. We see these things both horizontally and vertically across the businesses, and we have our arms around the business process, but also how we think about partnering with Optum Tech and product teams and the data teams to accelerate how we bring new value to the company.
Absolutely. I think our ability to see the end-to-end, as well as making sure that we are able to impact the entire journey of a member and provider, I think are great opportunities for us. I think the biggest opportunity that I also see is the ability of injecting AI and technology into our workflows to make sure that we are creating or just reimagining the way we run operations. I think is going to drive a lot of value back to the organization. So thanks a lot. That's a really, really powerful vision and some transformative change that we're driving across the company to make healthcare a better place and to provide a much better experience for our health, for our members and patients and consumers. So thanks a lot for being here. Thanks for sharing your ideas. Thanks for sharing your thoughts with us.
And thank you.
Thanks. And to the people that are watching, thank you for tuning in today. Like I said in the last episode, I think innovation is all about your bold idea. Innovation is about how you are able to convert that idea into outcomes. So keep innovating, keep thinking, keep coming up with newer ideas, and be bold in the way you do that. Thanks a lot.